Hi, I'm Dr. Chinmayie, a consultant at GarbhaGudi IVF Center. So today I'll be talking about how depression is going to affect one's life, or how common it is in infertility. So what is this infertility? When any couple, they're trying to conceive for 1 year and they don't see a conception, then they are termed as infertile. So if we look at the possible causes, 40% is because of males, another 40% is females, another 10% is unexplained, where we don't know what is the causes. So whenever a couple goes through this phase of infertility, we see at least 30 to 40% among them have some psychological stress, anxiety, or be it depression. Going through a psychological disturbances is quite common, because the infertility is something that is associated with a lot of social stigma, family pressure, social pressures. So all these things put together, we see the incidence of this depression or any form of psychological distress is quite common among infertile patients. So what is this depression? How one can identify themselves as they are going through depression? I'm going to tell you a few signs and symptoms, how they feel when they have going through this phase. When somebody experiences a low mood, lack of interest in their daily activities, low self-esteem, loss of appetite, not sleeping properly, not eating properly. So these are one of few signs and symptoms of depression. Whenever they're going through this phase, some might experience it in a minimal form for only a shorter period, some might have it in a severe form. So there are studies where n number of studies have been done. How common is this depression among infertile patients? It is seen about 40% of infertile patients, around 30 to 40% of infertile women experience depression. Among them, most of which, about 20-25% are mild, another 5 to 10% are moderate. It's only 5 to 7% of patients who go through that real severe depression who requires the proper psychological evaluation and treatment. Similarly, even in case of males, however, if you look at the incidence, slightly lesser in males, that is about 20% is what males undergo depression. So is it like everybody who goes through this phase is considered as depression, or everybody is termed as their depression? No, there is a scoring system that we follow. So each patient will be counseled and evaluated to know what is their level of depression. Do they really require a proper assistance, or counseling is sufficient, or therapy is required? So based on the scoring system, we know what is the severity of the depression one is going through. Secondly, most important parameter is what are the factors that will impact this depression, why one has to go through this depression and infertility. As I told you, it is a big social stigma, social pressure, peer pressure and surrounding pressure. Along with that, the treatment itself can put a lot of pressure onto the anxiety, stress and depression to the patients. So what does the treatment mean? Whenever one goes into the treatment of infertility, we know it is a time consuming one. So the duration, sometimes it might get prolonged, the duration of treatment, the results, most of the it is not 100% of course. So the results, sometimes when they face negative results, they go into depression, and the fear of waiting for the result can result in anxiety and stress. So all the treatment per se, the disease along with the other social background will cause depression among infertile patients. So how does it affect? Does it just affect their psychological mood, or do they really have an impact on their fertility status as well? Yes, it has been proven beyond doubt that whenever a woman goes through depression, anxiety or stress, there is a lot of hormonal imbalances that happens in the body. So we see some of the direct effects and indirect effects, such as there is imbalance in the endocrine system, meaning the hormonal imbalances is what we see. Second thing, there is imbalances in the immune system, the body, how the body fights against the immunity status of the body also gets affected drastically. So there are certain hormones which have been evaluated and seen that they go very high in patients going through stress, anxiety or depression, where there is increase of cortisol, increase of adrenaline hormones. All these things will cause imbalances in the basic hormones that is required for normal reproduction, such as FSH disturbances. The LH values may go high. Because of that, there is improper cycles will get delayed, or might have irregularities in the menstrual cycles, might have shorter cycles also. Some might notice a bit of spotting prior to the cycles. So all these things, one is it reduces the chances of pregnancy by reducing the oocyte quality. Second thing, it affects the fertilization. Third thing, it can also increase the chances of miscarriages. Meanwhile, what are the other indirect effects that it can have on fertility? So whenever a patient is going through this stress, be it men or women, there is an increased chance of them indulging into the other activities, such as there is increased smoking in them, increased alcohol consumption. So all these things in turn will further increase the chances of infertility, will further worsen the situation. So it becomes like a vicious cycle. So depression, anxiety, stress, worsen fertility. For because of infertility, there is again worsening of depression. So we need to break this cycle. So how do we tackle when a patient goes through this depression? First and foremost, counseling. Counseling plays a major role. One is by the doctor, by the counselor. So what do? We explain to the patients what is the problem. So firstly, we need to evaluate what is the issue, how we are going to tackle the problem, what kind of treatment they might need, how long they might have to be. So when we educate oneself about how long the duration of the treatment is going to be, how it is going to be, they do understand it and the acceptance of the treatment will be better. Second thing is by a counselor regarding their to bring down their emotional status. Along with that, other methods such as indulging themselves in activities like maybe some sort of sports or hobbies they like to keep them busy and happy, or yoga, meditation. In GarbhaGudi, we do have a holistic approach in patients who undergo IVF or any form of infertility treatment. Whenever we see that they need a psychological support, we have a counselor who comes in play. Along with that, we have something called as healing sessions, where people who have too much of anxiety and depression, they can undergo these healing sessions. So in case if they are in the moderate to severe form of depression, they require therapies or treatment will be necessary, where accordingly some of the drugs are safer, which can be used during fertility, during planning for pregnancy, and it is safe for pregnancy. Those particular drugs only should be used so that it can be safe for them to plan their pregnancies. So with all these methods, by counseling, indulging in activities like hobbies or meditation, yoga, plus education of the patient, will help to overcome one's psychological distress, be it anxiety, stress or depression. So though depression is very common, we can definitely tackle it in infertility, and one should keep in mind that this can also have an effect on the treatment, can reduce the success of treatments. So that has to be taken care of. Thank you.